Welcome to the treatment group video for paraphilic disorders and gender dysphoria. I will be presenting on sexual sadism disorder today. My client is Isaac Zimmer. He is 35 years old, and my name is Dr. Miranda Moses. We have two differential diagnoses. The first one is sexual sadism disorder, and the second one is sexual masochism disorder. We ruled sexual masochism disorder out because the client was not feeling pleasure when pain was inflicted on him. So we ruled that out, and then we ruled sexual sadism disorder in because all of the diagnostic criteria had been met. We have two primary diagnostic features. The first one is sexual urges, fantasies, or behaviors involving inflicting psychological or physical suffering / humiliation of another person. The second one is this urge has been present for at least 6 months. So getting into Isaac's story, he is a personal trainer, and he's seeking evaluation because he fears that he might hurt someone or kill someone because of his sexual impulses. He is married to his high school sweetheart, and he's been married to her for the past 12 years. And she's very attractive and attentive and a caring wife. And he has very warm feelings towards her, but the relationship feels more like a friendship than a marriage. And he admits that he's only sexually attracted to men, but he could never admit that to anyone because he doesn't want to be judged or rejected. However, 2 years ago, he got a new client, and this client had asked him about his sexual attraction, and he doesn't know why, but he answered honestly, and this client actually ended up becoming he started dating this client, and he found himself falling in love with this client, and they started dating. So, on one of their dates, the client took him to a bar where they basically, whoever goes to this bar can experience either inflicting pain on others or getting pain inflicted on themselves. And he really started to explore his this sexual world. And he discovered that he really enjoyed inflicting pain or humiliation on whoever his sexual partner was, and this really intensified his sexual experience. And since he had felt powerless for much of his life, this really led him to feel like he could reclaim this power and feel more himself. So he ended up breaking up with the client, with his old client, and devoted all of his free time to these sexual encounters that included inflicting pain. His marriage really began to suffer because of this, and he was focusing elsewhere, and she had mentioned getting a divorce, and he really did nothing to discourage her. And it sounded good to him. He didn't really want to be married to her anymore, but he didn't want to say anything. And he was even entertaining the thought of coming out to his family and to his wife, things like that. But his most recent sexual encounter is what brought him in for his psychiatric evaluation. He was with one of his sexual partners, and his partner asked him to burn a cigarette butt on him, so he did that, and in the heat of the moment, he pulled out his pocket knife as well and slit the man's arm, and he loved this sense of because he already had liked the smell and the feeling of the flesh burning from the cigarette burn. He saw the blood trickling down the man's arm when he cut it as well, and he had this fleeting urge to kill him. And because of this urge, he got all of his clothes, he got up and he left as soon as he could because he was fearing what he would do next. He's coming in for evaluation now because he's afraid of what he might do to the next person that he has a sexual encounter with. So that is it for Isaac's story. So the multi-axial diagnosis, axis 1 is sexual sadism disorder, axis 2, none, axis 3, none, axis 4, possible divorce, and axis 5, his GAF is about 65. So we have two theoretical perspectives. The first one is the biological perspective. The client's symptoms may be due to a neurotransmitter imbalance. He may have a deficit of serotonin, which would explain his impulsive sexual behaviors to inflict pain on others for pleasure. And the client may be feeling a sense of pleasure associated with a normal dopamine excretion when engaging in his sexual behaviors. The second one is the behavioral perspective. The client's symptoms may be due to a faulty learning experience. The client's behaviors are due to classical conditioning because of a stimulus-response association between inflicting pain on another and feeling sexually aroused. He associates his involuntary sexual arousal with inflicting pain on others. This association then results in operant conditioning because every time the client is hurting others, he feels good, which is a pleasure response. And his behavior is then positively reinforced because then he wants to feel that pleasure again and will engage in the behaviors again. So that is it. Thank you for watching.